I'm here to talk to you about narcolepsy, and over the course of this video I'm going to tell you what causes narcolepsy, what symptoms you should be looking out for, and how to treat narcolepsy. So what is narcolepsy? Well, it's a sleep disorder, and it's one you've probably heard of before, but when most people think of narcolepsy, they think of people falling asleep. This is the case whenever it's portrayed in the media, and it's often very lighthearted and funny. While falling asleep is a main symptom, there's more to narcolepsy than just sleeping. But anyway, I'll talk more about the symptoms later. So how many people are affected by narcolepsy? Well, it varies from country to country, but in America it's about one case in every 2,000 people. It can be much higher in other countries, like Japan for example, where it's one case in every 600 people. It's also very underdiagnosed, with an estimated 200,000 cases in the US, with only 50,000 diagnosed. This suggests that maybe the symptoms of narcolepsy aren't as well known as other disorders. On that note, let's move on to talk about the symptoms of narcolepsy. So narcolepsy has four main symptoms: extreme daytime sleepiness, cataplexy, sleep paralysis, and hallucinations. There are other symptoms to talk about a bit later, but for now, let's stick to the main four. Extreme daytime sleepiness is experienced by almost all narcolepsy sufferers, and it's just as it sounds. It's when a person feels very sleepy throughout the day and often falls asleep at various times of the day. They may only be asleep for about 30 minutes or less. The sleep can be triggered by strong emotions such as fear, happiness, or excitement. Side effects of extreme daytime sleepiness include a cloudiness of the mind, lack of energy, and depressed mood. They may also have trouble focusing their attention on a task, and some individuals suffer from memory lapses. Cataplexy is a sudden loss of muscle tone and leads to feelings of weakness and loss of voluntary muscle control. Cataplexy is experienced by about 70% of people with narcolepsy, and in about 10% of cases, it's the first symptom people experience. The loss of muscle tone can vary in severity, and there can be a slight droop of the eyelids, or complete physical collapse, where the individual won't be able to move, speak, or even keep their eyes open. No matter how severe the collapse is, the person will remain conscious. As with extreme daytime sleep, cataplexy is often triggered by strong emotions, with laughter being reported as the most significant trigger. Sleep paralysis is when a person is unable to move or speak when falling asleep or waking up. The person, however, is still conscious during this time. This is believed to be caused by the REM-induced inhibitions of voluntary muscle activity. This would normally go unnoticed, as people are normally asleep when the inhibitions are active. Sleep paralysis can be a traumatic event, especially when first experienced, but sleep paralysis often only lasts a few seconds to a few minutes, after which the person quickly recovers. The last of the four main symptoms is hallucinations. These can occur during sleep paralysis, but they can occur when people are falling asleep or waking up. The images are usually vivid and can be scary. The hallucinations are most commonly visual, but other senses can be involved too. Those are the main symptoms, but there are also other symptoms associated with narcolepsy, such as lack of nighttime sleep or trouble getting and staying to sleep. Narcoleptics often suffer from vivid, scary dreams. A rare symptom of narcolepsy is automatic behavior, where an individual who has suddenly fallen asleep will continue the action they were performing before they fell asleep. For example, if a person fell asleep while writing, they would continue to perform a writing motion, drawing jumbled up squiggles. Because of the rareness of narcolepsy, it can take up to 10 to 15 years before the disorder is properly diagnosed. This is mainly because the symptoms of narcolepsy are also associated with other illnesses such as infections, depression, and other sleep disorders. So it's always important to inform your doctor of any unusual symptoms. So we've talked about the symptoms of narcolepsy, but what's it like living with narcolepsy? How does it affect the individual? Well, as you can imagine, narcolepsy really can interfere with almost every aspect of people's lives. Driving can be a serious problem depending on the severity of the disorder. Some narcoleptics will be able to drive, but it's advisable that they always check with their doctor to make sure it's safe for them to drive. For a lot of narcoleptics, their condition constantly interferes with their everyday life. Paul Beals was diagnosed with narcolepsy at age 46, but he remembers feeling the symptoms since he was a teenager. At 62, he was interviewed by the New York Times about his disorder. When talking about it, he said, "I have what I call attacks, where for you it would feel like if you went for 48 hours without sleep. My sinuses usually slam shut, and it's really hard to breathe through my nose. My eyes will water and I'll yawn uncontrollably. I really have to fight sleep." Paul now takes medication and 2 short naps a day to help him stay awake at his job. With constant lack of energy and the excessive daytime sleep, individuals with narcolepsy often find it difficult to form romantic relationships. It's because of all these factors that narcoleptics often feel depressed, which in turn makes their quality of life even worse. Okay, it's about time we talked about the causes of narcolepsy. Narcoleptics often have low levels of hypocretin. This is a chemical in the brain that promotes wakefulness. What causes the loss of the brain cells that causes the low levels of hypocretin is unknown, but it's believed to be autoimmune. This means that the immune system attacks the hypocretin-containing blood cells. Some theories have been proposed as to why this happens. Some believe it's an inherited gene that affects hypocretin. In 10% of cases of narcolepsy, people report having a relative that has the same symptoms. There are a lot of other explanations though, such as the result of infections or brain injuries such as tumours. Birth month has also been a proposed risk factor for narcolepsy. However, a study by Donjacour et al. Conducted in the Netherlands found no relation to birth month and narcolepsy with cataplexy. So we've covered almost everything we set out to over the course of this video, but there's still one more subject we need to talk about, and that's how to treat narcolepsy. I'll start by saying that there is no cure for narcolepsy, but there are medicines that can lessen some of the symptoms. Modafinil and amphetamine-like stimulants are used to alleviate excessive daytime sleepiness. For most people, these are quite effective in keeping an individual alert. Antidepressant drugs are used to control cataplexy. Mainly tricyclics and selective serotonin and noradrenaline reuptake inhibitors are used. Antidepressants have the advantage of producing fewer adverse effects than amphetamine. In addition to the stimulants and the antidepressants, there is also specific drugs used to treat narcolepsy. Typically, Xyrem is used, and it induces a deep restorative sleep and reduces the symptoms of both daytime sleepiness and cataplexy. Unfortunately, the drug is not readily available due to safety concerns associated with the use, so its distribution is tightly restricted. So that's everything I was going to cover about narcolepsy, but I do have some links for you to check out if you want to find out a bit more about narcolepsy. First, I have 2 links that will give you a bit more insight into what it's like living with narcolepsy. The first is a piece on the New York Times website. There are 6 short audio clips from people with narcolepsy. It's actually where I found the piece on Paul Beals I mentioned earlier. The second link is a mini documentary on current TV. It focuses on a 21-year-old narcoleptic as he attempts to get Xyrem to alleviate his symptoms. He also describes his disorder, and at about 6 minutes, it's definitely worth a watch. Next, I have 2 links for a lot more detailed and clinical information. First, we have the National Heart and Lung Blood Institute. They have some very clear and well-written information on narcolepsy. Then there's a link to the National Institute of Neurological Disorders and Stroke website. They have a lot of information on narcolepsy. It's not as easy to read as the previous piece, but it's a lot more informative. So those 2 will be very helpful if you wanted to find out a bit more information on narcolepsy. So that's just about everything I was going to say. Here's where I got my information from if you're interested, and here's where I got all the images that I used in the video. Thanks for watching.